Hi, everyone. Good morning. I'm Anitha, and I'm going to be moderating today's session. And it's nice to see that there are so many people here on a Sunday morning. Today, we'll be exploring a relatively new branch of medicine called lifestyle medicine. And before we begin, I would like to go a few points regarding the protocol that will be followed during the session. So kindly remain muted, and any questions you may have can be entered into the chat box, and it will be addressed towards the end of the session. It will be 2 hours long, and the speakers will present for the first hour, and the second hour will be a Q&A. So let me introduce our three speakers. Dr. Anitha Kankar has been a primary care physician practicing in Los Angeles for the past 25 years. A graduate from KMC Mangalore, she has now incorporated lifestyle medicine into her practice after being board certified last year. She has conducted workshops for diabetes reversal and has presented on lifestyle medicines in schools, temples, and for other doctors in LA as well as India. She likes to spend her free time hiking and has completed the Everest Base Camp trek as well as climbed Mount Kilimanjaro on a plant-based diet. Our next speaker is Dr. Veena Acharya. She is an obstetrician and gynecologist trained at KEM Hospital, Mumbai, and has been in private practice in Bangalore for the last 25 years with a subspecialization in fetal medicine. Pursuing her passion for healthy living, she's a board-certified lifestyle medicine physician from the American College of Lifestyle Medicine. So our first speaker today is Dr. Prathima Kini, and she is a consultant pathologist in Bangalore. She too graduated from KMC Mangalore and studied pathology from Bangalore Medical College. She has been an exercise enthusiast and has run many marathons. She developed an interest in lifestyle medicine, becoming a board-certified lifestyle medicine physician, and has been applying it in her personal life as well. So now let's start the session, and I'm going to hand it over to Dr. Prathima Kini.
So thank you, Anitha, for the kind introduction. Good morning, good evening for people who are signing in from other countries also. It is heartening to see so many of you who have tuned in to hear us today. And thank every one of you for making time out on a Sunday morning and Saturday evening to hear us who are so enthusiastic and excitedly wanting to present lifestyle medicine to all of you. Let me start with the brief agenda of how we are going to go about. After the opening remarks of Anika, I'll be introducing the lifestyle medicine. This will be followed by the talk on nutrition and substance abuse by Dr. Veena Acharya. Dr. Anitha Kankar will be talking on exercise and sleep, and I will end the session with the stress and relationship aspect of the lifestyle medicine. After this, we will be taking the Q&A and the closing remarks. Now, I want to start with a short story, but let me put a disclaimer here that this is a work of fiction, and any resemblance to people alive who are no longer with us, it's purely coincidental. So, the story of Mr. Karthik. He is a businessman in his early 40s living in a metro city. He works close to 12 to 14 hours a day, has a busy schedule, and travels multiple times in a month on work. Let's take a glimpse into Karthik's family history. This is Karthik's grandfather, who, after having grown up in a small village, moved to the city to set up a business. At the age of 78, he suffered a stroke and he succumbed to it a few months later. Karthik's father, who was diagnosed in his 50s to have diabetes and high blood pressure, had a heart attack and underwent a bypass surgery. Thankfully, Karthik's father received timely care and so could be saved. Today, at the age of 43, Mr. Karthik is at his doctor's office and he has just been told that his sugars are on the higher side and that he has developed high blood pressure. This story must be resonating with many of us. Is Karthik's high blood pressure and diabetes because of his family history, or is it because of his lifestyle? We can argue that this is in his genes, and so no matter what he does, he will get it. But what if we were to tell you that Karthik need not have the same health outcomes which his grandfather and his father had to undergo? That a lot can be altered by him changing his lifestyle? I know most of you would have heard that, but let me explain this to you all further. Karthik probably has the genes which makes him prone for diabetes and hypertension. But as we say in lifestyle medicine, genetics loads the gun, lifestyle pulls the trigger. The history of lifestyle medicine is intricately tied to the history of mankind. We were earlier hunter-gatherers, and after that, we started farming and started agriculture. Essentially, we used to work all day and have a home-cooked meal derived from the food and that was grown in our farm and from the animals that were there. Which means we moved all day, we were more in nature, had small amounts of food. Over the past 100 years, not only huge gains in industry, transport, and technology, life has been made very easy. Not only this, we have made so many advances in healthcare, where we have added vaccination, antibiotics, open heart surgery, radiologic imaging, early and improved diagnostic tests for cancers and other conditions, advances in childbirth, enhancement in blood transfusion and in organ transplantation. So all these things have improved and increased our lifespan. But what about our health span? Despite making so many incidents, the advances, the incidence of heart disease, obesity, and diabetes are on the rise. The problem probably you see is maybe how we are approaching this illness, the illnesses. We are too busy mopping the floor that we forget to turn off the faucet. That is why we need to see what is the root cause of illnesses. The actual causes of death are not heart disease, cancer, or diabetes, as shown in this graph. The causes of death are lifestyle behavior changes like smoking, poor nutrition, and inadequate physical activity. In India too, despite, even though we had COVID, cardiovascular disorders are still the leading cause of death, both in, the urban as well as the rural setup. 30% of Indians suffer from cardiovascular disease, and 80% of these disorders can be, changed or reversed by lifestyle changes. 70 million diabetic patients are there, and maybe an equal number of patients have not yet been diagnosed. You'll be surprised to hear that obesity is so rampant that by the end of this year, 50% of Indian women are going to be obese. 1 in 5 children are obese. So what can we do? The 6 pillars of lifestyle medicine. By definition, lifestyle medicine is an evidence-based approach to preventing, treating, and sometimes even reversing the diseases by replacing these unhealthy behaviors with positive ones, which we have referred to them as the 6 pillars of lifestyle medicine. This includes a whole food, plant-based eating pattern, regular physical activity, restorative sleep, stress management, avoidance of risky substances, and having healthy relationships. The power of lifestyle medicine lies in the combination of these 6 pillars. We, face a lot of resistance, like it's shown in this cartoon. people will have, we feel that we are preaching to people, but you will have a lot of obstructions, barriers, personal, family, and social reasons why you will not be, able to do these changes. But I'll paraphrase Dr. Kaushik Reddy, who's a cardiologist in the US, who says that, 1 minute, okay, who says that, ask yourselves, what do you want? Why do you want to be healthy? And many times, all of us will have the answer because we want to have quality and we want to have longevity. And this is what we can gain by lifestyle changes as described in lifestyle medicine. In lifestyle medicine, we work as a team. Together, everyone achieves more. So many studies and trials have been conducted from 1970s to date, and it has shown that lifestyle medicine has potential for, at the fraction of a cost of healthcare system and the pharmaceutical drugs that have been used. If you look at it, from a distance, apart from nutrition, every other pillar is essentially free of cost. So the objective of lifestyle medicine is not only to add years to life, but to add life to years. And to again quote Kim Williams, who is a legend in lifestyle medicine, I'm not afraid of dying. I just don't want it to be my fault. So with this, I want to, end my introduction to lifestyle medicine. I now hand over the thing to Veena, who will take over the first two pillars of lifestyle medicine.
Hi, good morning, everybody. Thank you all for joining us this morning, like Prathima said, in our enthusiasm to share what we know about lifestyle medicine, hoping that we can help you increase not only your lifespan, but your health span as well. We heard from Prathima about the changing spectrum of diseases. Like, earlier days, we had infectious diseases years ago. About a century ago, what plagued us was probably influenza, tuberculosis, malaria, etc. And with advent of medications, these have come down. And what's ailing us today are what are commonly known as the non-communicable diseases or lifestyle disorders. That's diabetes, hypertension, heart attacks, strokes, etc. So with the advent of all the medications, we have, mastered the treatment of the infectious diseases with pills. You have a bug, you have a pill, and we are done. And we probably are continuing to apply the same principle to the treatment of these lifestyle disorders whose root cause is not a bug. So we would probably end up treating the symptoms, but not addressing the root cause of the disease. So lifestyle medicine aims to do just that. So employing these 6 pillars, we are looking at improving not only the lifespan, but the health span as well. Because otherwise, what use is it that we are living longer than our forefathers? Or are we living longer, or are we dying longer? Because we are adding years to our life, but are these being spent productively? In the last 2 decades of life, which I have gained because of the advent in modern medical technology, am I raising a toast at my grandson's graduation, or dancing at my granddaughter's Sangeet, or spending time with my old friends, catching up at reunions? Or am I busy making appointments for my dialysis, going in and out of ICUs, etc., etc.? That is where we said, let's not die longer, but let's add life to our years. So the aim of this webinar today is to help you understand that by making these changes, we can live well, live healthy, live happy, and live longer. So coming to the pillars that I'm talking about, the first one is the nutrition. There is so much research on nutrition, it can add to a lot of confusion. In fact, we've heard about so many approaches for diets, and each one of you can get enough evidence to say that the diet you are following is the best based on the way you look at literature, the way you interpret the literature. So, to separate the chaff from the grain and present you the evidence-based, what the evidence truly points to, here I go. So am I going to be prescribing a diet to you? So absolutely not. What are diets? Diets are generally restrictive. They have a connotation of being, I'm not supposed to eat something, etc. And they're most often even time restricted, in the sense, I've made this New Year resolution. So the next 3 months, I'm going to be down 10 kgs. So it also means that my 10 kgs are down and I can go back to being what I was doing before. Or I want to have my cousin's wedding coming up. So I'm going to fit into this dress. And then once the wedding is over, I'm back to where I started. So here we are suggesting changes in your lifestyle. Start small, add things here, remove something there. And the cumulative benefits are going to be big. And once they start showing, you're going to continue to live this way and see the benefits. Because you don't want to start on a diet. The chart itself says, if 100% of the people began, at the end of 3 months, there are only 90% following it. And at 7 months, it's down to 10%. And it peters down completely by the end of 2 years. And the aim of what we are saying today is not that. Make small baby step changes, but continue to have them so that you gain big at the end. So the importance of nutrition can be seen on this saying, okay, which was told in the 19th century by Thomas Alva Edison, that the doctor of the future will no longer treat the human frame with drugs, but rather will cure and prevent disease with nutrition. So why isn't this happening? Because this was understood way back then, but we have not reached anywhere close to that. In fact, our dependence on medications has increased. Our dependence upon hospitals and doctors are increasing. So where are we going wrong? So this is what the Egyptian proverb said. 1/4 of what you eat keeps you alive. The other 3/4 keeps your doctor alive. And we are trying to help you reverse this ratio so that you don't or minimally visit your doctor. So this is a study done every 4 to 5 years about the global burden of disease. What is really ailing us? So you've heard all these statements. Heart attack is the #1 killer. India is the diabetes capital of the world. Cancers are on the rise. Obesity rates are skyrocketing. Prathima did mention that. And unfortunately, studies are showing that we in India are increasing our obesity rates at a much higher rate than the world at large. The obesity rates in children is tripled in the last 30 years. We have obesity and average overweights ranging from anywhere from 11 to 30% and 50% by the end of 2030. And that is humongous numbers, because obesity seems to be a single most important contributory factor to all these other diseases that are mentioned in the slide and more. You know that COVID has hit us and we all have read about it. I don't know if we allowed us to sink in that obesity and these comorbidities, along with COVID, made the outcome of COVID much worse. They kept telling us that the ICU admissions and the fatalities were far more if you are obese or if you had any of these comorbidities. So we got to take care of what we eat so that, these diseases can be controlled. So this is again a picture which shows that in the last 10 years, 2009 to 19, because of advent of better medication, diarrheas, tuberculosis, pneumonias, neonatal disorders in diseases in children came down. But what happened to ischemic heart disease? Heart disease, heart attacks went up by 40%, diabetes for 50%, strokes, cirrhosis, and COPD, all of them have increased. So let's understand something before, when we talk about nutrition, why do we eat? Do we eat to live or live to eat? Hunger, this is the most common determinant of why we should eat. And if we are only eating to live, this should be the sole determinant, isn't it? But it doesn't happen that way. There are myriad other reasons, for example, by habit. Now it's lunch break. Everyone's opened their, in your office, everyone's eating, or we have stopped to eat lunch. So out of habit, you go out to eat, whether you're hungry or not. Pleasure. So I've done something, or I like this kind of food and it's available today, I want to eat it. I want to reward myself because I have met a deadline. It's a birthday or it is an anniversary. We need to celebrate. I'm feeling low. I'm upset. I need to console myself by eating my favorite ice cream. It's a ritual. Ritual may be even a festival. It's Ganesh Chaturthi. We need to have a huge lunch or a huge celebration, but the dishes you made will continue to live in your fridge for the next 2 weeks. Social expectations. We are meeting up friends, so we go out for a big dinner. Curiosity. There's a new restaurant come up. I need to go and try out what they're serving. Boredom. I have nothing to do. It's COVID, locked up. I'm inside with this lockdown. I will eat. Mindless eating, just because the food is there. Or I'm watching television and there lies a pack of chips. Okay, so because there are so many other determinants to our eating habits, we got to be extremely careful what passes through our lips, so that should not be damaging, but it should be nurturing to us. Let's also understand why our food habits are changing. See, food and agriculture. Earlier days, food was grown, agriculture was the way, food was bought and sold. Then with everything else, industrialization moved into the food, the agriculture as also aspect as well. And now it became a food industry. Now with industry, there is going to be profits, losses, sales, marketing, etc., etc. And then food became food products. And the industries employed food scientists. You would wonder, what are they doing there? Are they going to give us healthier food? No, absolutely not. Their focus is on serving their employer, not you, the consumer. So they were here trying to make foods which lasted longer, the shelf life is longer, made it tastier, made it even addictive. You kind of craved to want to eat it more. You've heard the oft-repeated commercial which says, you just can't eat one. Yes, that's precisely because it was made that way. So it is considered that food addiction can be comparable to tobacco or heroin addiction. So we have additives, and what are the biggest culprits are fat, salt, and sugar. Now adding these three will make it similar to, the same centers in the brain which are triggered by addictive substances triggered by this combination. That is why in nature, you will never find them together. A fruit is sweet, but it's not fattening. Something else is fattened, but it is not sweet or salty. So putting these together, adding these additives can make this food into food products and make us crave for them. Then came convenience foods. So we refined foods. So removed the fiber from it, made it last longer. We made it processed and packaged because you could cook in 2 minutes. Your kids can make their own meals. It's very alluring when that is said, isn't it? But in turn, to make this food, this kind of tasty, easily cooked stuff, there is a lot of goodness which has been removed from the original food, and probably many harmful additives which go into it. You have to learn to read labels. Next time you go to a market and you're picking up one of these packaged products, look at the ingredient list. It's fine print, unfortunately. Sometimes at my age, I need to carry a magnifying glass if I need to buy that. Because it has flavor enhancers, nature identical flavoring agents, you have stabilizers, preservatives, and so many other things, and which are all chemicals which are going to be harmful to us, and they're going to, whatever little goodness is remaining, that's going to be, countered by the addition of these chemical additives to the foods. So what else is this doing? It is making these food products calorie dense by the addition of salt, sugar, sweet, and they're making it nutrient poor, as against whole foods which are in the nature, which are full of their goodness, and nature has packed them with so much of fiber so that they're not calorie dense. So you can have a lot of it, but still not take in too many calories, but get the benefit of the nutrients which are there in the whole foods. So that is why choose the first part of the slide and try to shun the second as much as possible. So I've been telling about whole foods. Let's understand why and what. So here's an apple. That's a whole food. Doesn't come with an ingredient list. You go to the market, you buy apple, you know why that is apple. Whereas on the right hand side is an apple juice. Now this is 300 ml of apple juice, which probably would take about 4 apples to be, squeezed, the fiber and the phytonutrients thrown away, and probably to make it last longer. It is going to turn rancid, isn't it, in 3 days if it's kept on the open shelf. So there is something going to be added. The flavors probably removed, so you have flavor enhancers. You have stabilizing agents added. So this is what is processing or refining. So you're made to feel that you're getting the goodness of an apple by drinking the apple juice. It's absolutely not there. Worse, imagine to get 300 ml of juice, you might have used 4 apples. Can we really munch through 4 apples at one go? But you can glug 300 ml of apple juice with all its sugar in 10 minutes, isn't it? That is what refining is doing to our diet. Peanuts, again a power source of protein and fat, and good fat and a lot of fiber. That is why it would limit the amount that you can consume so that you're not going to get too much of the fat anyway. Now what did we do? We squeezed it out, threw away the fiber, and made this concentrated product, which is the oil, which is only fat and devoid of all the goodness. Now this is my favorite. Look at the potatoes, a poor, much maligned vegetable. You're diabetic, don't eat potatoes. It's full of good vitamins and minerals. And in comparison, here are a packet of chips. Now, let me tell you, if you need to say 1,000 calories of potatoes, steamed, baked, cooked in your curry, it would take literally 1.5 to 2 kilograms of potatoes, which I'm sure none of us can finish it on one go. Whereas, if you picked up a stack of Pringles, wherein the potato has been added with 33% of fat, okay, by weight, it has salt, it has again all these flavoring agents, and 200 grams, which is one pack, which probably you would finish watching half a movie, is 1,000 calories, right? That is why refining is removing the goodness and adding the bad stuff into it. That's why Eric Schlosser said, fast food is popular because it's convenient, it's cheap, it tastes good. But the real cost of eating never appears on the menu. Now, coming to how excessive fat consumption can affect our health. This is about the mechanism of how diabetes is caused or it's perpetuated. Now, here is, you all think that diabetes, it is got to be sugar. I'm not supposed to eat sugar. I eat too much sugar, my diabetes goes bad, but the rest of the foods are all okay. Please understand, this is a very important slide for you to understand the mechanism by which diabetes and pre-diabetes even happens, and it gets worse. So this is a muscle cell which is bathed in the blood, which has the glucose. Now, once you eat, the glucose increases, it has to enter into the cell, but it cannot enter unless there is a gate called the receptor which opens. And what's the key which opens this door? It's the insulin. So we eat in food, insulin gets released, comes into the cell, opens the gate, and the sugar walks in. and the muscle utilizes the sugar and we are happy. Now, what happens when you eat a diet like this? So there is excess fat. You don't really need that much. And what happens next? This fat gets accumulated in the muscle cell. Now, the muscle cell thinks, I have enough energy inside. I don't need any more glucose. The insulin key does not work anymore. And the sugar cannot enter. So the sugar level goes up in your blood. You're told to be having pre-diabetes or diabetes. And if you decide, I want to do something, get rid of all the fat in my diet and in my muscle cell, your insulin can act again. Your glucose can come in again. And your blood sugar level falls. So what did you do? You didn't stop eating the sugar. You corrected the basic mechanism by removing the fat from your diet, therefore exercised, moved more, the fat in your cells melted away, and your sugars got better. Similarly, what else can fat do? So these are the arteries, the blood vessels in which the fat, the cholesterol deposition happens, and it starts getting narrowed. This is a pictorial depiction how a plant-based, whole food plant-based diet person's artery looks like, the blood vessel. There is going to be some fat. There is healthy fat in all our bloods. A vegetarian, so-called, because now here comes the dairy. And this is a meat eater. So all these can lead to blockage of blood vessels and result in heart attacks, strokes, paralysis, kidney disease, arthritis, dementia. So this slide also shows a study which was done, which measured the amount of saturated fat. Saturated fat is a type of fat which is found in meat as well as in dairy. If a person consumed, there's half the population consumed about 13 grams per day, and there was another subset which consumed 25 grams per day. The Alzheimer's, which is a type of dementia, doubled by increasing the saturated fat consumption. So this seems to be the root cause. The blood changes in the blood vessels is one of important ways in which all these diseases are created. So you do understand why I'm harping about whole food plant-based diet. Let's understand a little more about the calorie density I was talking about. So what does 500 calories of food look like? If you were to consume it as oil, which is very little, a few tablespoons. Can you see the movement of my mouse?
Yes, Veena, we can see.
Yeah. So oil, that's few tablespoons in your stomach. If you add cheese, yes, there is a little more. Meat, yes, probably about a third of your stomach. But if you had potatoes and beans, that's about, you're 3/4 full already. And if you had used fruits and vegetables, you're going to be stuffed with just 500 calories. Therefore, if you are on a weight management journey, you've got to keep track of calorie density versus nutrient density. Why am I talking about nutrients? Because these plants are very rich in phytonutrients. Phyto means plant. So they have a lot of antioxidants, vitamins, minerals. They are packed with it. And all that benefit is there in addition to feeling full with the fruits and vegetables. And for the reasons that I already told you, this would prevent disease. And believe me, it's good for the planet. It's a long, it would make my talk much longer than what it already is. But to produce animal food, it takes a lot more of Earth's resources in terms of land, water, and even deforestation, etc. So it is very, very bad for the planet to be on an animal-based diet. I just put this part of the slide about the milk because I know a lot of you are going to think milk, the nectar, the panacea for, everything. So how can it be bad? Yes, milk has certain goodness, but it still has a lot of animal fat. And of course, it has got animal proteins, casomorphin. That's another story altogether. So let's stop believing that milk is a nectar for these reasons. Again, comparing the nutrient composition of plant and animal foods, you can see, I'm saying again, we are comparing what of two sets of foods, what can give us 500 calories of energy. If you ate potatoes, beans, and peas, versus if you ate equal part of, some meat like chicken, beef, or whole milk. Let's see what's the nutrient like. This these are all the fiber, the vitamins, the minerals in humongous numbers. See, they're on double digits, 4 times higher than the animal foods. Okay. Now, next comes, this is my favorite part, protein. I know some of you sitting are going to think, where am I going to get my protein if this woman's telling me not to have animal foods? They are equal in protein. Where did the animal that you ate get its protein from? All of them eat plants, right? So it manufactured the protein and you're eating that protein and saying that that's the best thing to do. Why don't we manufacture our own proteins by all the amino acids which are there right through the plant world in various amounts? So if you take 500 calories of energy from plant and animal sources, there can be equal amount of protein in both. Now comes to the top of the slide. Cholesterol and fat, which we don't want to have for the reasons I already stated to you. They are in much, much higher amounts in the animal-based foods, and almost there is no cholesterol, none at all in any of the plant-based foods. And of course, there is some good fat. So foods versus nutrients. Yeah, again, I have got to be on diet. If I ask a patient, what do you think you have to do? Your sugars have come high. I have to limit my carbs. What do you mean by that? You don't go and buy 2 kgs of carbohydrates, 3 kg of proteins, 4 kg, etc. Our food comes as an entire package, right? There's carbohydrates, proteins, fats, and various amounts in everything. So let's not dissect it finer as to what's carb, fat, protein. Let's concentrate on eating carbs from whole foods and avoid refined foods. Let's eat all our proteins from all plant sources, legumes and beans, even spinach has proteins. Fats, nuts and seeds is where you should be getting them from. Minimize the oils, animal fats, because they have oils have lost all their goodness and animal fat can be bad for your health. So therefore, the emphasis should be on whole foods. That is why I just put this part of the slide to tell you. Plant proteins, beans, peas, potatoes, spinach, everything has proteins. You make a good plant-based meal, you can get the equal amount of proteins from what you get from a animal-based diet. So this is, I couldn't stop. I have to tell you about what else the whole food plant-based diet will give you, which is absolutely not there in an animal-based diet, zilch, fiber. And fiber is called the superfood. And what is fiber? It is a part of the carbohydrate which has no calories. And this is seen only in the plant world. And what are the benefits of fiber? It gives us a lot of satiety. You feel full because the fiber fills you up. It reduces your overeating. Your weight is managed better. Heart health. There is an inverse relationship. The more fiber you eat, the less is your chance of developing heart disease. It reduces cholesterol and there is inflammation. This is one thing which I had to tell, but it's again makes it much longer to talk about inflammation. Please know that inflammation is now known to be the underlying cause of most of these lifestyle diseases. So if anything you have to reduce this inflammation, improves your health. And fiber is very good at reducing inflammation. Again, diabetes and pre-diabetes. Fiber reduces the incidence. It slows the absorption of food. Therefore, it doesn't give you glucose spikes. The demand of insulin, demand of medications goes down. It is extremely important in the gut. We need to talk to you about the microbiome. Now, microbiome is all the bacteria that are there in our gut. They're so important, they're now considered one organ by themselves. Okay, so a healthy microbiome is again very good to maintain good health. Their effect is there way beyond the gut. In fact, microbiome can affect your brain. What is called as a gut-brain axis exists. So you have to take care of your microbiome to take care of the health. So apart from, the fiber is a very good food for these healthy bacteria. So we maintain a healthy microbiome by eating adequate fiber. We maintain overall health and very good at relieving gut-related problems like constipations, piles, or hemorrhoids. Cancer, fiber is extremely well known to reduce the incidence of colorectal, breast, as well as intestinal cancers. So, what are the right food choices? A whole foods plant-based diet. Increase your vegetables, fruits, legumes and pulses, whole grains, nuts and seeds, and add a lot of flavoring with herbs and spices. You don't need the oil. It is not a diet, it's a lifestyle. Reduce processed and packaged foods, refined foods like maida and white rice, bakery and fried foods, sugar sweetened beverages, sugary drinks, juices, desserts, artificial sweeteners. Artificial sweeteners can really be damaging to your microbiome. Animal products like meat, eggs, and dairy, and oils. The WHO has classified, World Health Organization has classified processed meats as group 1 carcinogen. And even red meat is known as a group 2 carcinogen. Carcinogen is something which creates cancer. So this is what we are eating. Not very long ago, we did not look like this. Our plates did not look like this. The samosas, the kachoris, the jalebis, and the dosas with all that blob of butter. What do I want you to eat? Just like your grandfather did, your forefathers did. It's such a healthy meal. It's there in our tradition, right? This is what a proper plantain leaf meal looked like. And this is what we want you to go back to, full of healthy whole foods. A whole food plant-based plate is what we would want you to take from this talk, because poor diet and nutrition is a leading cause of death and disease. So 1/2 of your plate should have fruits and vegetables, drink plenty of water, 1/4 of it should be plant proteins, and 1/4 of whole grains. That's why Dr. David Katz said, your DNA is not your destiny, your dinner is. And why your DNA is not destiny? It is DNA in our genes. All of us carry some bad genes, something which can trigger off diseases like diabetes or cancers. But what unlocks the key? This DNA is remaining locked. And at some point in your life, it gets expressed or the genetics get unlocked. And this unlocking can be prevented by an optimum health and lifestyle. So live your life well, eat your dinner well, and your DNA does not get unlocked at all. So you do not have to express your bad genes, although you may carry them. Therefore, it is said that it's not the genes that are passed on, it's the bad recipes. So as a lifestyle medicine physician, what am I trying to tell you? I do not expect you to start eating that kind of a plate from tomorrow, but you can start small. This is what my prescription to you would look like. Frequency, say, eat thrice a week of what? 1 salad serving for lunch maybe, with a lot of green leafy vegetables, other vegetables, nuts and seeds. So what I'm trying to tell you, eat 1 large serving 3 times a week at lunch. Use all this. This is what I will prescribe to you as a lifestyle medicine physician. And if you do this in 2 weeks, you will realize that I'm eating a large salad, so I'm eating less of something more. That's what I said. Take small steps, add something, remove something. And after 2 weeks, we could try something else. So to put it in a nutshell, nutrition for optimum health is just 7 words. Eat food, eat not too much, mostly plants. This is what Michael Pollan said. And this is best describes every lifestyle medicine physician's mantra for nutrition advice. So this is again a very pictorial description of what is going to look like if you had the refined animal foods and refined products with a whole list of diseases which come with it versus a plant-based diet. I quickly finish with substance abuse. This is the next pillar that I'm talking about, avoidance of risky substances. What are we talking about? Tobacco, smoking, chewing, or any other form. Even second-hand smoke, very detrimental. Vaping was considered to be a better substitute or an alternative. Unfortunately, it's found to be not so. Alcohol, group 1 carcinogen from the WHO. Pan, betel, and arecanut. I was quite surprised. This is quite a common habit in India and in certain Southeast Asian countries. The betel nut with arecanut and lime, even with or without tobacco, is considered a group 1 carcinogen. And other recreational drugs. Tobacco, this is a leading preventable cause of death and disease. It kills more than 8 million people each year. 7 million of them die direct use of tobacco. Another 1 million, unfortunately, being exposed to secondhand smoke, the family and friends of the smokers. And a large number of the smokers are in the low and the middle income countries, therefore increasing the burden of healthcare in these countries. And on average, smokers die 10 years earlier, and 67% of them die from one or the other smoking-related diseases. Pan, again, I told you already, this is considered group 1 carcinogen. Even without the tobacco, the lime, the arecanut, and the pan can cause changes in the lining of the mouth, which can give rise to cancers in the future. So this is a whole list of diseases, how tobacco kills us. Cancers, lung disorders, heart diseases, stroke, asthma, women, like fertility problems and birth weight, low birth weight baby, diabetes, and a whole host of cancers. So much so that, as medical students, if you had to talk about risk factors of certain cancers, you could blindly write nicotine or smoking there. Alcohol abuse, 3 million deaths every year. Again, alcoholic beverages are classified as group 1 carcinogen by the WHO. It increases the risk, reduces the immunity, increases the risk of infections like tuberculosis and HIV. Range of mental and behavioral disorders were seen. It's also implicated in liver disorders, diabetes, injuries, accidents, self-harm, and suicides, memory loss and dementia. And in pregnancy, it can cause a specific disorder called as fetal alcohol syndrome and even give rise to preterm births. And of course, we can't overlook the social and economic losses to individuals, to families, and society at large. So in summary, health is not written on your genes. Genes are not your destiny. It's the lifestyle. Every great journey begins with a single step. So begin and make a difference. Your journey to a healthier lifestyle is not a journey that you start and then give up. It's a journey that you're on, living every day for the rest of your life. Health is not a matter of chance. It's a choice. Thank you. I will now hand it over to Dr. Anitha Kankar, kindly joining us late night from Los Angeles.
First of all, before starting my presentation, I would like to congratulate Dr. Prathima and Dr. Veena for getting board certified in lifestyle medicine. And they're here already spreading the benefits, the message of lifestyle medicine. Okay, so thank you for patiently waiting. I'll be talking about exercise and sleep. These are two important pillars of lifestyle medicine as well. We always, most of us usually think diet is the main one, but in lifestyle medicine, we try to see how each one is interconnected, how each one is as important as the other pillars. Most of you already know about exercise, and it's nothing new. Sushruta is one of the first physicians to prescribe daily exercise to patients. And Charaka in 250 BC, he has prescribed strenuous exercise to cure diabetes. So normally we always hear once you have diabetes, you have it forever, but it's not true. It was even then they used to cure diabetes. Most diabetes, I mean, type 1 is you cannot cure, but the other kinds of diabetes you can. So in lifestyle medicine, like as you have seen, what is different from other natural medicines, because all these are, the pillars are all we have been taught, especially in our Indian culture, we know everything. But in lifestyle, we always want evidence, and which is, I mean, you might find evidence, but this here, I mean, you can repeat it quite often. So that's why lifestyle medicine is a little bit different. So this is one study for it's a diabetes prevention program where they did a study, and some of the patients were only on lifestyle, and some of them were put on metformin, and some of them just placebo. This is for pre-diabetic patients, that is anyone who is between 100 and 125 fasting blood sugar. So they tried all these three to prevent them from getting diabetes, and you can see how lifestyle, actually they who were on lifestyle, they were more, this was more, they were 58% reduction in incidence was seen with this. And this study, actually they stopped in between because they found, it's not fair for others to be on this when lifestyle was better. And second, so this is another study for depression where you can see, like for 4 months, they were treated with exercise. The black one is in for exercise, and then with medication. And after 4 months, after 6 months, 4 months of treatment, and at 6 months, you can see how the recovery for depression was still there in the exercise, the ones with exercise, and with the medication, only 50% recurrence rate was there. And with the combination also is not that much. So exercise is like a good prescription for depression. So what is physical activity and exercise? What's the difference? So physical activity is any movements, any regular work when you're doing, all those are also, which is also very important to do, like, so all these things. And then exercise is something which is planned and structured and repetitive, which you can do at home or in a gym. So why do we want to do physical activity? It is just to, not just to do our tasks and, everyday things, but, this is the most important thing, to stay independent as you get older. And also other things, there are less pain, better mood, and lower risk of many diseases. So it's not just the exercise, what we have to focus on, like you will see some people who will be in the office the whole day, and in evening 1 hour they go to the gym, but there is not much benefit in them. So that's because you have to, the whole day you have to be moving, and that's why it's called non-exercise activity thermogenesis. So anything you can be doing, like gardening, cooking, just watering the plants in the morning, and then walking to the shop, and like, going on the stairs instead of the elevators, and having some stretches in the daily routine, especially if you're sitting in the office the whole day in front of the computer. It's always recommended to, every hour you have to get up and do some like at least 2-3 minutes of walking. And the best way is when you're on the phone, if you keep walking and talking, that is also a good way to do. And usually people think like, okay, I'll eat all this food, but I can burn it off and go to the gym. So that doesn't really work. So it's not like math, because exercise and it has all different they have benefits. It's not just calories. And like you saw, like how Dr. Veena described, like, the calorie, each calorie like consumed are different. How much quantity is there in the stomach, you could see that slide. So there's a lot more than just calories or protein. So it's not equal. So treat each pillar equally. Don't overdo with one. You can't. So how much activity do you need? It is very simple. Not too much, and it's easily attainable. It's 150 minutes a week. That's almost like 30 minutes a day. And then always include at least 2 days of strengthening exercises. So that is one thing. We are always only focusing on, walking and all that. So you have to have your muscle strengthening is very important. So the other topic I'm talking about today is about sleep. So sleep, not many of us give any importance to sleep, but it is, we usually think, is it a waste of time? And most of the time you think, oh, I don't need, I mean, if, with little sleep, I can survive, and they feel very happy about it, that you'll be productive. But then do you ever, think about it, that 1/3 of our life is spent sleeping. So there must be so many things happening in our sleep, not just physical rest. There is so much thing happening in our body. So sleep is also very important. So poor sleep is actually comparable. It's compared to physical inactivity. So someone who doesn't sleep, and also there's someone who people without any physical activity, both of them, the risk of developing diabetes is almost same. It's comparable. So in lack of sleep, what happens? So this is for diabetes. This is one of the most important thing. Whoever has diabetes, they can actually check one night of they don't sleep enough. The next day, the glucose levels will be high. So sleep is very, very important. Same thing with high blood pressure. It increases your hunger. It's linked with obesity, and then immune response. It decreases immune response with lack of sleep. Increased risk of Alzheimer's. We are seeing a lot nowadays, dementia and Alzheimer's. That's one of the reason is lack of sleep. It affects the next day's mood, and it's also correlated with some cancers. Can anyone guess which movie this picture is from? You can. It's Shah Rukh Khan's movie. I think, okay. Sorry, I can't see the chat, but yeah, it is from movie Swadesh, where you can see they got light to the little village. So our sleep problems began with the invention of electricity like over 100 years ago. So our grandparents slept 1.5 to 2 hours longer than us, and we sleep one cycle less, and we'll see why that's important. Okay, so Dr. Prathima talked about all the food, what to eat, and then now you know what to eat, but sometimes you are not able to make the choices. How, so exercise is important. Similarly, even sleep is very important, because in sleep, if you have sleep deprivation, this one hormone called ghrelin will increase, which will make you more hungry. And also when this hormone, which makes you feel it's called a satiety hormone, so and that decreases. So sleep is really important to make good food choices. And not only the choices, less sleep, it increases calorie intake, and in normal sleep, you have decreased calorie intake. It's not only the calories, you'll actually crave for more sugary and fatty food if you sleep less. When they do MRI on those people, the pathways that they light up with high calorie foods, the reward pathway lights up. So it's very important to have sufficient sleep, that is 7 to 9 hours. Okay, so I'm trying to go quickly today because we don't have enough time. So, but this is a very important slide which will understand why sleep is important. See, these are the cycles we go through in the night. Okay, these are called sleep cycle, and they go through REM sleep and NREM sleep. We have different sleeps, and you can see how different it is in different cycles, each one. So there are a lot of things going on in each of these cycles. In the first 2 cycles, usually, there is like all the memory, whatever things we are doing, they're just going and filing somewhere, just as like facts, they're going into different folders and they're just being filed. In the later stages, these connections are being made, and creativity, problem solving, like usually they say, oh, sleep over it, you'll get the answer tomorrow. It's not just a saying, that's what happens in the last cycles. So that's why like Alzheimer's, dementia, everything is because these connections, if they're not made, then that's how you will have dementia and stuff like that. So that's why it's very important to have a good, all the cycles should be there. Also, this in REM sleep in the beginning, it's only repair of tissues and cells. Whatever are injured, they get repaired. But in the here, the REM sleep is big, longer. So here, this is where the mental and emotional clearing, the fear factor, all those. So emotions also are very important. How our mood is and everything. So all these are happens here. So it's like very, I mean, a lot of things happen so if you sleep less, like an hour or two less, this one whole cycle is gone. So all the work which is being done in this last cycle, it will not be done. Like food, you can, one day you eat less, next day you can eat more, it will make up. Even exercise, even though we said 30 minutes every day, you can make it a weekly average, but sleep you can never make up. I mean, you might sleep and these things will be okay if you sleep the next day, but these making connections and all these other activities will not be done. So that is why sleep is very important. And quickly I'll go. So you have to set a exact time every day to sleep. So that schedule is very important. And then if you can exercise 20 to 30 minutes, but not just before sleep, because at that time if you sleep it's harder. And then avoid caffeine. 3 up to 3, it has a long half-life. So after 3 p.m., I think the evening coffee you should avoid taking. And then relax before bed, like taking a warm bath or reading instead of being on the phones or computers. And create a room, to avoiding bright lights and TV and all those stuff. Avoid having that in the bedroom. And if you're awake for a long time, just get up and then read a book or something and then come back. Don't be lying at the bed. And then there are sleep specialists now, you can check with them also. So yeah, so that's my end of the presentation. So thank you. I would like to I'll be happy to answer questions in the end, but I'll go ahead and talk to Prathima.
Thank you, Anitha. I'm going to take over the next topic, which is stress. So a diamond is just a piece of charcoal which handles stress exceptionally well. And this has been told by Dr. Hans Theil, who said that it's not the stress that kills us, it is our reaction to it. Stress is a part of everyone's life. It does not discriminate. It affects everyone. Men, women, rich, poor, at home, in the workplace, at play, overweight, skinny, it does not matter. No person is immune to stress. 80% of doctors' visits are stress-related to ailments and complaints. Stress was something that was ingrained in us, and it was an integral part of our life, and it was what we call for a fight, flight, or a freeze response. It was a response when there was a predator coming, and we wanted to decide what we wanted to do. So this is what was initially what it was meant to be. But today, the stress we have is different. It's about family, about jobs, about work, about worry, about debts, about, the maid not having come. Everything is a stress. And then there is something called as eustress. Stress is not really bad. So sometimes, you have what we call as the good stress, that is called as the eustress, where in case you need to write an exam or you need to make a presentation, like I am doing, I'm a little stressed out, but then this helps me perform because, this stress is what is driving me to perform. But if this stress was to be extreme and if it was to last a very long time, it is going to lead to disorders. And how this is going to lead to disorders, let's just check it out. So if we see, when we have a short stress, we have a raised blood pressure. This will help us to, increase the blood that is going into the brain and the muscle. But if it is for a long time, it will cause risk of heart disease and stroke. Short amount of stress also will increase our blood clotting. It is basically like, if you've been chased by an animal and the animal happens to bite you, to decrease the amount of blood that is going to be lost, we have this increased clotting mechanism. And if this is for a longer time, it can lead to stroke, to heart attack, and what we call as deep vein thrombosis. Increased insulin resistance is developed. This is again actually protective because we want more sugar to going to the, the brain and to the muscles so that, you can decide what you want to do or you want to run. But if it is there for a longer time, it can contribute to diabetes, to obesity, high blood pressure, and an increase in cholesterol. Now, there is also an increase in cortisol that is required. So, they say cortisol, sex hormones, they're all steroids which are formed. So what does the body do is say, okay, the sex hormones can wait. We need cortisol. So let's go and, produce more cortisol. But with this, if it is for a longer time, it leads to hormonal imbalance, causes lack of libido, menopausal symptoms, and also infertility issues. Also, digestion is not considered an essential time when you're in danger. But if it is for a long time, it can lead to complaints like constipation, bloating, and irritable bowel syndrome. Small amounts of time for a short time, cortisol going high will, help you, to make your brain function better. But in the long run, it can kill your nerve cells. Emotional brain is on high alert when, there is some danger and when there is stress for a short time. But if it is for a long time, you get prone to anxiety. So even if that danger or that fear is not there, you will be all the time anxious. And lastly, like we've been harping all along, it's inflammation that is the root cause for everything. But here, with regard to stress, it causes your immune system to go haywire, making you more prone for infections, diabetes, obesity, autoimmune disorders, and also obesity, for depression. So how do we deal with stress? We are saying that stress is there everywhere. Now, stress can be acute or it can be chronic. But in both the cases, the best thing you can do is just breathe. So in acute, there are different types of breathing. We've heard a lot about in yoga also, which is very, very useful. Even the anulom vilom that we do is supposed to be very, very beneficial. Doing 5 minutes of, these breathing exercises twice a day can go a long way in trying to, ease the stress in us. Second thing, what you can do is meditate. There are different forms of meditation. Just sitting and meditating is not only the thing. People will be sitting and meditating, even walking is a kind of meditation. You're doing it, mindfully. That is also meditation. Exercise, any type of exercise, whether it is yoga, you're running, you're going to the gym, any type of exercise is good, provided you are consistent with it. Next, you need a good quality sleep. You can't stress on this more. Anitha has given such detailed, description, and sleep is very important. Spend more time in nature, what we call as the forest bathing. Go out there. Just looking at the picture of nature is supposed to really calm and, get your stress levels down. And this is so, so important, being mindful. This picture depicts, what we humans are like. Our minds are filled with so many thoughts and things that are happening in our life. But what we need to do is actually be like this dog who is being there in the present, in what he is looking at and enjoying the moment with his master. And the last one is improve your social connectedness, which brings me to the final pillar of lifestyle medicine, which shows that connectedness is what is really required. Social connection is so, so important for our well-being. Loneliness is more dangerous than obesity and has damaging, it is as damaging to the health like smoking 15 cigarettes a day. People are, hardwired to do human connection. We are born to connect. Man is a social being and it energizes them. Oxytocin, which we call as the love hormone, is, which helps, it is secreted in large amounts when we do these kind of connections like hugging, cuddling, holding hands, and even petting. Having a pet and petting animals is supposed to be really, really fulfilling. Social ties also benefit the immune system, the endocrine system, and the cardiovascular system. It can increase a person's lifetime by up to even 50%. So what we appreciate, appreciates. Next, I want to tell you about this Harvard longitudinal study, which started in 1938, and they studied some 724 young men. It was only men here because Harvard did not admit women in those days, but then they started studying the wives and the children of the young men, and it is a 80 years long study they found. And the surprising thing that they found is the only thing that added happiness and longevity to man was social connections. They gathered everything that they knew about a person when he was at the age 50, and they found that the most important thing that kept him healthy at 80 was how good his relationship was when he was 50 years of age. And finally, we have to talk about what we call as connecting with the self. It's not just that, we need to talk with so many other people. We need to be with one another, with each other. We need to study ourselves. This is not given much priority to. You have to know what your feelings are, what your strengths are. So you need to have self-love, self-respect, and self-care. And this is very, very important to have a healthy lifestyle. Be kind to yourself. Only if you love yourself, you can love others. You cannot pour from an empty cup. And the journey to self-discovery is a part of lifestyle medicine journey. Before I finish, I need to have to, include this about happiness and positive psychology. Here, we need to dwell a little more because we don't, have time or even, look at it in our healthcare system. Focus on what you have. Focus on what you can do. And focus on what is under your control, like your behavior. And like Martin Seligman has put it, you need to value your life by having happiness and positive psychology. And in short, he has put it as PERMA. So we need to have positive emotions where we need to build it by being grateful. There is nothing else more important than being grateful. In fact, they say if you write a gratitude journal, even, just 3 things that you write, in 15 days, you see that there is improvement in your health. You need to engage yourself. You need to be doing something that is challenging to your brain, something that you enjoy doing, something that you get involved in. That helps you, keep in better health. R stands for relationship. Reach out to someone that you have not spoken in a long time. See how happy it makes you and the other person. Have meaning in your life. Do something that has purpose. It can be, a simple thing, just being kind to a stranger, or, just helping your neighbor with the groceries, or just picking up something from the ground somebody had put and it gives. It's not that you're doing something for gain, but it gives some meaning to you. And A stands for accomplishments. Through your life, you have accomplished so much. It may be a big thing, it could be a small thing, but reflect on it. See that, you know that you have done some achievement and accept it. And last but not the least, laugh. Laughter is still the best medicine. It's not that, you should stop laughing because you grow older. You grow old because you stop laughing. Thank you for being patiently here, all of you, and listening to us. I want to end this by saying that every journey begins with the first step. Thank you all. this is all that we have to say about lifestyle medicine. We just have one testimonial from, to play, because we felt that, you should hear it from the horse's mouth. You should know what patients are actually feeling. So just here is a small glimpse of what, a patient had to share with us.
आई होप सब ठीक होंगे. सबसे पहले मैं वीना मैम को थैंक यू बोलना चाहूंगी कि उन्होंने मुझे इतना मोटिवेट किया कि मैं अपनी सारी बीमारियों को ठीक कर सकी हर तरीके से, है ना. तो थैंक यू सो मच वीना मैम कि आपने मुझे इतना मोटिवेट किया और मैंने अपनी लाइफस्टाइल सुधारी. और सिर्फ लाइफस्टाइल ठीक करके और अपना एक हेल्दी डाइट अपना करके आप हर चीज ठीक कर सकते हो, अपनी हर बीमारी ठीक कर सकते हो. मतलब इंस्टेड ऑफ टेकिंग मेडिसिन आप अच्छा खाना खाओ, है ना. जैसे सुबह मॉर्निंग में उठे, बस एक ग्लास हल्का गरम गुनगुना पानी पिया, फ्रेश हुए, फिर अच्छा सा ब्रेकफास्ट बनाया अपने लिए, साथ में ढेर सारा फ्रूट्स, ढेर सारे सैलड्स के साथ एक बड़ा सा ब्रेकफास्ट आप करो, है ना. आप उस इतना अच्छा खाने के बाद ना आप अंदर से हैप्पीनेस फील करोगे, है ना. और अगर आप अंदर से खुश रहोगे तो आप हर चीज मतलब बहुत अच्छे से कर सकते हो यार. मैं कैसे समझाऊं आपको कि अपने लिए अपनी हेल्थ कितनी इम्पोर्टेंट होती है. आपको और कोई नहीं ठीक कर सकता सिवाय आपके, कोई भी नहीं. बस हर लोग आपको एडवाइस करेंगे, डॉक्टर्स आपको मेडिसिन्स देंगे, डॉक्टर्स एडवाइस भी करेंगे, बट जो आपको काम करना है ना अपनी बॉडी पे, वो आपको खुद को करना है. जस्ट आप इंचार्ज लो अपनी बॉडी का. सबसे पहले आप सीखो कि अपने आप को कैसे खुश रखें, है ना. अपनी मेंटल हेल्थ को कैसे प्रायोरिटाइज करें. और एक बार अगर आप खुश रहना सीख गए, अपनी हेल्थ को प्रायोरिटाइज करना सीख गए, देन आपकी हेल्थ आपको प्रायोरिटाइज करना सीख जाएगी और आपकी हर एक बीमारी अपने आप धीरे धीरे ठीक होने लग जाएगी. अभी ज्यादा दिनों की बात नहीं है, मैंने पिछले ही साल बहुत स्ट्रगल किया अपने आप को ठीक करने के लिए. मतलब मेरी भी हैबिट बहुत खराब थी. बहुत लेट नाइट खाना खाना, बहुत लेट से सोना, बहुत लेट से उठना. बट
So the first question is intermittent fasting useful? I eat 2 times a day at 10 a.m. and again at 8 p.m. Is it okay? Please advise. Whoever. Yeah.
Perfectly okay. Fasting is coming back as a method of treatment of many things. If you're doing that and if you're finding it fine, please continue to do so. You're doing a lot of good to yourself.
Okay, thank you, Veena. The second question is, do we require supplements to be fit? Anitha, would you want to take that?
Yeah. So the beauty of this whole plant-based is you don't need any most supplements except for vitamin B12. That's because whatever fruits and vegetables we get are already washed, and our water we get it in the tap. We don't get it from the rivers or anything. So that's the only reason why we just need vitamin B12. That is 2500 micrograms weekly. And for some vitamin D, it's not just because plant-based diet, because we know vitamin D is made in the skin from the sun. So that, because we are not outside as much and all that, so vitamin D is another one which you can check, and only if you're deficient you can take. So otherwise you don't need any other supplements.
Okay, so the third question is solution for knee pain. A lot of people have put this query, for knee pain. Is it reversible? And then there is neck pain, shoulder pain. How do you reduce joint pain? So.
Okay. Yeah. So one thing about knee pain would be if you're overweight, if it would help to reduce your weight to an optimal level, the pain come down. Again, I was telling you about atherosclerosis. Even in all these joint problems, your blood vessels supplying the joints, the synovial membranes, if they are blocked, that could be one of the reasons why you're having knee pain. Whole food plant-based diet, which is again full of, green leafy vegetables have something called nitric oxide, which will even dilate or improve the circulation. So losing weight, being on a whole food plant-based diet can help. I'm not saying that you 100% you're going to get better, but try this as a first thing. And if not, you can get to your doctor.
Okay, so this is a little longer question. I have lost my primary nerve, that is the sural nerve on the foot, and grafting was done. Partial recovery on sensitivity, but I have problems related to adrenaline rush and cortisol due to pain. Currently under medication and using pregabalin and clonazepam. Any way to escape from these neuropathic medicines? Okay, I will just say that, there is not much research done in case of these injuries, but we can only say that in diabetic neuropathy, a lot of research has been done, and it has been shown that, a whole food plant-based diet can really help with the neural pain. In as close as as short as 3 weeks, people have started saying that there is improvement in their neuropathic pain that is there. So you could try it. I mean, the thing is, there is no side effect to this kind of therapy. So you can always try it. Is type 2 diabetes reversible? About pre-diabetes? Again, we have already spoken about it at length.
I would again say reversal. Remission is a better word.
Yes. I think we
you
need
will
to
come
insist.
under control. You can go off diabetics. You go off your medications even. It's still debatable. Reversal is a long process. You should not have had it for so many years. Your lab values have to be normal for length of time. So you aim for remission with your off tablets, then you maintain it, then you be called reversal. There are enough studies which have proven that a whole food plant-based diet can do it.
Why is my immunity low in spite of having good food and exercise? How do I tackle this problem? Yeah, so we have to focus on all the 6 pillars. It's not just, having good food and exercise. And having good food and exercise is very relative. What you say is good food may not be what, somebody else says. So we really need to, look into it in more detail.
And
now,
stress can bring down your immunity. Stress can bring, you are eating well, exercising, you're stressed, your immunity goes down.
Exactly. Yeah. So this is, I think, it will need some time. Thyroid imbalance and its effect. Veena?
Okay. Thyroid is a hormonal, it's an endocrine gland. Okay. So it is very sensitive to many things. The things I was talking about, all the additives, like, the preservatives, all those things can cause what is called as endocrine disruption. Okay. So be very sure, that is the reason why you can have a thyroid dysfunction. Second is insulin resistance. Though we say insulin resistance is implicated in diabetes, it's also known that the thyroid gland can have a similar insulin resistance and lead to malfunction. And third, dairy. Dairy is supposed to be the proteins in the dairy. Again, the long-winded way I have to explain to you why it causes, but dairy is known to give rise to thyroid imbalances. So whole food plant-based diet, that it reduces your insulin resistance, improve your, reduce the dairy consumption, should help you in your thyroid imbalance. You want to add anything, Prathima?
I think wheat also to some extent, because wheat, the earlier what wheat we get and the wheat we are getting now is very different. Plus we are, it is all genetically modified, and also we use a lot of pesticides in growing. So, we kind of say it is better to use organic one. So, there is less of, the pesticides, and you don't get organic genetically modified ones. So that's one thing I just would like to add for this. There is, my heart goes out to this person who says that I do an hour of yoga, walk for 45 minutes and exercise, exercise cycle for 20 minutes every day. I eat sensibly. Yet I keep putting on weight. I'm sick of losing weight with diets. How do I stop weight increase? I think the talk has explained a lot. I really empathize with you, and I hope you can take it forward using what has been described over here. We are always there. You can reach out to us, and we can help you out with whatever that needs to be done. Next question is fasting sugar more than PP normal. What diet to follow?
Yeah, there are so many reasons for this. So, I mean, whole food plant-based will definitely help. And like how we said, the sleep is very important, stress levels, due to stress, the hormones will go up. There are many reasons. And late night, what snacks you eat, those kind of things. So, yeah, it is just to have a balance, whole food plant-based, and then stick to all the pillars. But still, for some people, it is fasting still remains a little bit high. But if your hemoglobin A1C is okay, then it's fine.
Yeah. So the next question is about vertigo. Vertigo is bothering me because I get the attacks quite often. Anything that we can offer on this?
There is on the internet, you can look brand Daroff exercises. You can look it up. They are pretty simple to do. Okay. If you do consistently, they do give a lot of benefit in vertigo.
Okay. I would like to know if walking to cover 10,000 steps every day is good for the knees in the long run. There is no doubt. I mean, yeah, it should not affect.
Yeah, it should not affect. It should 10,000 is what is recommended, 7 to 10,000 steps, so it should be fine.
Yeah.
So if you're in pain, that means some circulation issues are going on. It's actually a sign, before your heart attack comes, it's actually telling you if your knees are hurting, that means circulation is going down. So your diet, like what we explained earlier. So the fats, if you can reduce, and having the whole food plant-based will actually help.
So how to make, this person seems to be already knowing a lot of lifestyle changes, but how to make significant lifestyle changes just by consistently developing small habits over a long period of time. That's exactly what lifestyle, medicine is all about, making small changes over a long period of time. It's excellent. You already know it. You just have to continue with this. Hypertension. Yeah, Anitha.
I would recommend them to read a book called Atomic Habits. It's a great book to how
Right.
Put it here. How you can add small habits, how you stack habits to one another. Like if you, 2 things at a time, like stacking they're called. So you can you make habits which will be regular and it will help you. So.
PCOD, yeah. We most of the times PCOD have obesity as a component. Okay, let me tell you, polycystic ovarian disease, it's been a common fancy diagnosis. Anybody goes with any irregularities, you send them to an ultrasound and then it says PCOD. You don't have to worry if their ultrasound says polycystic ovarian disease, a picture. If your periods are regular, if you're normal weight, if you don't have overgrowth of hair, you're fine. Just an ultrasound report, put it under the bed and forget about it. But if you do have, when you say disease, there are various components to it. You're not getting regular periods. You're having difficulty in conceiving if you're married. You have a little bit of excess hair on your face, etc. And you're overweight. The most important thing what you can do is do a lifestyle change, reduce your weight. Most of the things fall into place.
Thank you. So next question is about LDL reading 129, elevated lipid profile, and somebody has just put only cardiac dysfunction. I wouldn't know how to address the cardiac dysfunction, but I think, if you follow the lifestyle pillars that we have mentioned, everything should fall in place. All the lipid profile should come back, lower down, with some guidance, from lifestyle physicians and your doctor too. Now, severe recurring piles. once removed, again on verge of surgery, got COVID twice in spite of having being careful about nutrition and exercise.
So for
Anitha?
piles,
Yeah.
so what is more important is the fiber, so because we have our food doesn't contain much fiber nowadays, even, like simple things like even dal, what we eat, the skin of the dal is removed. So try to, get, eat as much fiber as you can, increase your fiber. The movements should be, bowel movements should be good. If there are any other issues like diabetes or thyroid function, your motility of your intestines are slow, so that can lead to constipation and which can lead to piles. So try to check if anything else is causing the constipation, causing the piles. So that is one of the things to be done. What was the second part?
No. In spite of having good nutrition and exercise, and having had COVID twice, this person is, suffering from this.
COVID is like, you can get COVID. That doesn't mean your immunity is low. It is just you are, at the wrong place and you got it. But getting the disease, if you are on plant-based diet and all better, following all these lifestyle, then you won't get really sick. So it's not your fault that you got it. But yeah.
Okay. My endoscopy shows pangastritis. Veena?
Whole food plant-based diet would help. Okay. There is, of course, if you have done an endoscopy, you probably have seen a gastroenterologist. There are certain infections called Helicobacter pylori, which can give rise to gastritis, and you would be treated and it should be fine. After that, I would say just eat healthy, eat a whole food plant-based diet. So when you take out the oils, the fried things, etc., your gastritis, your stomach will be thankful and it will settle.
Okay. There's someone who's mentioned about sinus, BP, and snoring. Anita, would you like to, because you took sleep, no? So
most of these things like snoring, high blood pressure, all these are all interconnected due to maybe our weight. So usually the whole food plant-based will help to reduce the weight, and which will reduce your snoring and your blood pressure. Sinus problem could probably be due to some mild allergies, which can also benefit. Whole food plant-based will help. So you're just hearing we are giving the same answer for everything. That's because most diseases are caused by the same, inflammation, all these, circulation problems, immunity, any autoimmune problems. So the root cause is almost very few things are causing all these problems. So that's why the answer is always for most of them, it's the same. So for all chronic diseases like arthritis or any of these things, this lifestyle will help.
Okay. Iron deficiency and how to handle for women who suffer from heavy bleeding during the monthly cycle. Veena?
Heavy bleeding may be the reason for your iron deficiency. So we need to get that sorted. You can't be, producing a good amount of blood and then losing it every month. So please get your gynecologist who can sort out why you're bleeding heavy. And once your bleeding is controlled and you have a healthy diet rich in iron, a lot of green leafy vegetables, dates and carrots and beetroots and spinach, you will be able to build up your iron stores. Okay. So first you have to treat the root cause. It's like, again, like Prathima told you, you have to close the faucet before we mopping the floor. Yeah. So why are you bleeding? We need to sort that out first.
So the first question is, as adults, parents and grandparents, we are convinced, but how do we convince our teenage children to make such lifestyle changes?
I just told that cook meals where they will not even know that, it's whole food plant-based pizza can be made. Okay. So cook.
You can make burgers. Yeah.
Delicious meals, and they will not miss the regular food.
And it's something the whole family has to do. You know, when we talk about lifestyle change, it's what the entire family is following. So what food you make, and if you know, what we also say is, you know, what you cook in your kitchen heals you more than what the doctor will give for you in the clinic. So
yeah, I tell my patients, you know, your kitchen can manufacture diseases and can heal diseases. That is where both of them can happen. And so please be careful what you are putting on your plates. And that's exactly what I tell them. We are not telling a diet so that one person eats this brown rice, the rest of them, you all are eating white rice. We want you to make a lifestyle change because it's good for everybody. It's not just because someone has a disease. The other one will not get a disease if you continue to do this way.
You can start as baby steps, you know, you can start doing it in certain things like in idlis and those kind of places. You won't know what kind of rice is being used, and slowly start incorporating. If you do everything together, it's very hard. Try little one step at a time. Small meals you can change.
Honestly, you won't know, because for a while I used to do this, and in a conference, in a webinar like this, somebody asked me, how does your husband agree to eat like this? I said, he's an accidental vegan. He doesn't know he is.
The next question is, while we are emphasizing on good food and plant-based diets, etc., what's the impact of using pesticides and chemical fertilizers on these food sources? Eating more of this would also increase the side effects of these pesticides.
Okay, first is try to get organic produce. If that's possible, that's the best thing you can do. If not, it is still better than eating an animal-based diet. Okay, so your animals have eaten the same pesticide-ridden grass or whatever, and it gets concentrated in their bodies, and you're eating a much larger dose of the same thing when you eat an animal protein. And also when there is animal farming, like, you know, your chicken, poultry farms, here they are not free range chickens eating what they want and growing. From the age, the first 45 days, a chicken had to be grown into I think a 3 kg thing, and it's given antibiotics because they're in a close confinement. They should not get diseases. They get given, you know, hormonal things to improve their growth, etc. So what stuff you're worried about, you're eating in a larger proportion when you eat an animal protein rather than eating plant-based food.
So also there are ways to remove the pesticides. You cannot remove it completely. So you can put just simple salt water. If you soak it for 10 minutes in salt water, most of the pesticides will be gone. Also, you can look into, there is something every year, there's an organization who puts up the clean 15 and the dirty dozen. So those kind of fruits and vegetables, if they are part of the dirty dozen, try to avoid getting the regular and try to get organic ones. But clean 15, you're fine to get the regular. You don't need organic stuff.
The next question is, as a part of my lifestyle, I meditate an hour every day with agarbatti or incense sticks. Am I inhaling the harmful chemicals in the smoke? Is the side effect the same as passive smoking of tobacco?
Pretty much, we would say, you don't have the 5,000 chemicals that are there in the cigarette, but it's still not rid of all the chemicals. It still has chemicals.
The next question is, shouldn't supplements be based on the blood test, because blood tests will show you what you are deficient?
Yeah. All the supplements, should be based on the blood test, but we do know if you're completely whole food plant-based, you do need vitamin B12. You can still do the blood test, and if it's normal, it's fine. But in the beginning, few years, it will be normal, and then it will start going down. So that's the only thing we recommend. Yeah, you're right. You have to do the blood test, but vitamin B12 is usually recommended if you're on whole food plant-based.
The last question I have is, Dr. Veena mentioned inflammation. What exactly is that?
Okay, that would be a very long answer to fit here. But to explain to you, inflammation is what happens when you cut yourself. Okay, so there's redness happens, a lot of blood flow comes into the area. So that is that's called as acute inflammation. Now, what is known that we can have a chronic inflammation, means inflammation going on day in and out due to stress, due to the lifestyle, etc., which is now known as the underlying mechanism by which these lifestyle diseases like heart disease and diabetes and cancers can happen. So in a nutshell, inflammation is something which is essential for an acute thing, but when it happens in a chronic way, it's extremely detrimental. Any of you, Anitha, Prathima, you have anything else to say?
Basically, any injury will cause inflammation. Now, a cut was, an injury, so inflammation. But there are so many injuries that are occurring within us day in and day out, and the body is repairing itself. We are not aware of it because the body is healing itself. It takes, but if these injuries are going to be constant, chronic, always there, then, the body in trying to heal itself, in causing the inflammation, trying to heal itself, will cause diseases or disorders in us. I mean, this is very simply put. We can have an entire webinar just on inflammation.
Okay, so these are the videos and these are the books.
You can add Atomic Habits to it. I mean, that was given in the chat. So